All right. Well, hey, thank you for joining us today. My name is Adam Levy. Glad you could be here listening in. We're recording this so that people can catch it anytime, which is kind of nice. We'll be doing more of these as we move forward. I want to just thank Dr. Robban Sica for taking time out on this busy, well, for some people, busy Black Friday. And those of us who have more sense are staying home and doing business. But thanks for joining us, Dr. Robban. And I know that, we talked a lot about CBD over the past, few months, and you yourself have a lot of experience, really, I would say an expert on CBD, being that you've been involved in a few companies, experienced a few different products, and, basically have really become very knowledgeable about the subject. And so we're really glad that you're here to share and kind of clear up, because there's a lot of CBD noise out there, and that's kind of what it is. And I believe you're a beacon of light and wisdom in the subject. So Dr. Robban Sica, please share with us a little bit about your experience with 10xPure and basically your background that has you be so well versed in CBD.
Well, thanks a lot, Adam. It's been probably about 4 years that I've been researching phytocannabinoids and medical marijuana and like what these compounds do in the body and how they're helpful, how to promote health and balance the system out, how to maintain homeostasis in the body. Very fascinating to me. But early on, it was really frustrating because the only product that I could find really didn't work. And I didn't understand why we were seeing all these, thousands and thousands of studies being published on phytocannabinoids, and yet the products that I had available at the time, I just wasn't seeing the results with them. And then a year or so ago, I realized that most hemp oil is just not very well absorbed. It's only about 6 to 10% absorption. So whatever product you're buying, you're literally wasting, most of it. Most of it's just going through your GI tract, not being absorbed and not being, utilized by the body. And you really have to make the oil into more of a hydrophilic form. What that means is water loving, so the body can grab onto it and absorb it and get it into the tissues, that it can get through the cell membranes, that can even get through the blood-brain barrier. All of those things make such a huge difference in terms of the efficacy, in terms of what you actually see as results. And I think that that's what distinguishes the 10xPure hemp oil from the rest of the pack out there. Most of what you're going to find on the shelves of a convenience store or a vape shop or whatever, you don't even know whether that's a safe product, because hemp is a bioconcentrator. And what that means is that it actually pulls toxins out of the soil. And it's being used in a lot of different countries, in China and in India and other places, because it grows so fast to clean up soils that are contaminated. So obviously it's going to pull all of those toxins out of the soil, concentrate into the hemp itself. Now you can use that hemp to make rope or fabric or paper or whatever, but you don't want to consume it. So if you're buying a hemp oil product just anywhere, because of the CBD noise, as you put it, are you getting a quality product? Are you getting something that's concentrated toxins? That's a big concern to me. So to me, it's very critical that CTFO uses only organic, non-GMO hemp oil or hemp product to make the hemp oil, and that it's processed in a way that's not using solvents. And they on their website, you can actually see the various chemical analyses that show that there's no mycotoxins, there's no chemicals, there's no solvents, there's no pesticides, there's no anything in CTFO's hemp oils. Then we get to the area of bioavailability, and that's where the real the rubber really meets the road, because if you can get hemp oil, if you can get the absorption rate up to 80, 85, 90, 95%, which the 10xPure is, being absorbed at that level, then all of a sudden you're going to start to see results that you won't see with other hemp oils. You're going to start to see rapid onset of relief of symptoms, whether it's pain insomnia, anxiety. You'll notice it very, very quickly because it gets absorbed very quickly. And you're going to notice better results overall and fairly quickly, as opposed to having to take it for 3, 4, 5 months before you see, enough of it building up in your system to maybe make a difference. So I think that's, 10xPure is really a unique product in that the oil that is the base of 10xPure, which is called 10xPure, that's why the product's called 10xPure, in and of itself has antiviral, antibacterial, anti-fungal, and even anti-cancer properties on its own. It's an oxygenated essential fatty acid combination. So he's taken some very, very important essential fatty acids like lauric acid, which is very good for the immune system. It's very good antiviral. I've used it for years in my practice, and oxygenated it to make it more bioavailable, more hydrophilic, and therefore absorbable. And those products in and of themselves have some pretty potent health benefits. Then you combine it with organic hemp oil from CTFO, which is very top quality hemp oil. And now you've got a double pronged product that has health benefits on both sides. So the thing that's really unique is that the 10xPure isn't just the carrier that gets it into the body more effectively. It also has benefits of its own. So, I mean, to me, it's just a phenomenal product. And I like to tell my own story because I've been taking hemp oil for quite a while, because once you look at the 23,000 studies, I haven't looked at every single one of them, but I've looked at quite a few. You start to realize just how good this stuff is for you, that our body really needs these phytocannabinoids to balance the endocannabinoid receptors in the body that then helps to balance out our immune system, our neurotransmitters, our blood sugar, our blood pressure, everything across the board. Is that homeostasis of health is dependent on the endocannabinoid system. So I was just taking it for, last couple of years on faith, essentially. I didn't really notice a lot. I'm generally a pretty healthy person, so I didn't really notice any huge benefits from it.
Sure.
Until I switched to 10xPure, the 500 milligram, not the real high dose one, just the regular one, which is great. It's fine for most people. And within 2 days, the sense of mental clarity and well-being, like complete absence of depression or doldrums or any negative, like, it's just like, who is this person? Like, what just happened to me? And that's my own personal story after taking a really high quality product for the last over a year. That was an excellent product, never noticed a difference. And I think the difference is that this 10xPure, because of the way that it crosses the blood-brain barrier, that oil will actually, the 10xPure oils actually aid in crossing the barrier into the brain. So we have two barriers. We've got a barrier in our gut to keep out invaders, and that's why we don't absorb everything out of our gut. And then we have another barrier to protect our brain, between the blood and the blood and the brain, to protect our brain from infections and invaders and toxins and whatnot. So for something to be able to carry a healthy substance across the blood-brain barrier effectively is pretty amazing. And I think that's what it did. And I think that's why it changed for me, that it changed my mood and my sense of well-being and my mental clarity tremendously. I mean, I don't think I'm a slouch, but all of a sudden, your brain wakes up and it's like, whoa, where was I before?
So Robin, let me ask to kind of clarify this. So the 10xPure oil in and of itself has its own set of benefits. It's been used in the marketplace. It's now exclusive to CTFO. And that 10xPure oil is now being overlaid on top of our very high quality hemp oil, full spectrum, organic, and all those things that you said, third-party tested, important stuff. And so not only are you getting the benefits of the 10xPure, you're getting the benefits of the CBD, and then also together, because they're mixing, they are becoming, because this is a hydrophilic oil, this CBD oil is now actually getting into our cells a lot more effective. So we're not only getting the synergy, we're getting both benefits from each one, but also the synergy of them being combined. And there's really nothing on the market quite like it. Is that what you're saying about the 10xPure? Yes.
You said it much more concisely than I did, but yes.
Okay. That's one of the gifts I have is to talk to lay people. I don't have letters after my name. You do. So, but that's fine though. It's important to just kind of clarify what that all means, because people see a lot of CBD out there, and I always tell people, I go, yeah, that's because everybody wants it. It's a huge business, and you want to possibly take advantage of that and be involved. But, there's a lot of people just jumping on the bandwagon to get a piece of that giant business. Forbes says it's going to be $22 billion by 2020. So, it's going to attract all kinds, and there are going to be less scrupulous, purveyors of CBD that are just trying to get in on the income, on the money, without really being concerned about people being on that product for long periods of time and actually getting the results. They just want to make the money. But you're saying that CTFO has really not only done their homework, but created a unique product within the space. Is that accurate?
Absolutely. It's, to me, it's phenomenal in terms of, I'm always looking, how can I benefit my patients? How can I get people, the health benefits? How can I get them better? How can I get them healthy? How can I keep them healthy? And I was having this conversation yesterday at a party I was at, and, I explained what we were just talking about, the bioavailability and like how it interacts with the endocannabinoid system and all the different studies and everything. And the person I was talking to said, "Oh, so everybody should be taking this." And I said, "Yep."
And that's because of the endocannabinoid system and receptors that we all have, all vertebrates have. Is that accurate?
Exactly. All vertebrates and even some invertebrates. So it's like 60 million years of evolution or something like that. Some 600 million years of it.
So this is not a new thing.
This is not a new thing. We just didn't know about it because they made hemp illegal for...
Right. They suppressed it. Right. That's right. Wow.
So we didn't know about it until about 20 years ago, and then it's been real slow to catch on, and there's been a lot of legal challenges still.
I saw this great graphic recently of people lining up to get CBD, just lining up at this one booth, and then the other booth was Big Pharma, and they were like, "Oh, is that where we're headed? Is that where we're going?"
Yep. Yeah. Yeah. And it starts to sound like a panacea. It starts to sound like snake oil. Well, that's a whole nother story in itself, but because there really is a snake oil that really does work, but that's a whole other story.
Right.
But when you realize, like, if you give something that balances out the issue and corrects the problem at the fundamental level, then why do you need to take a drug to cover up the symptoms? Because you just won't have the symptoms, because you've actually corrected the problem from its source.
I hear you talking about homeostasis, and that's pretty much what it's doing, is it's bringing your systems back to homeostasis, back to neutral.
Back to balance. Yep. Back to what you should be. If your immune system is overactive, then you get too much inflammation going. If it's underactive, you get too much, too many infections, or you might develop cancer, so you need that balance. Your immune system has to be able to fight, but if it's too hyperactive, then people get autoimmune diseases and they get too much inflammation, and then, Big Pharma comes out with a drug to just shut your immune system down, and then you develop cancer. Oh, great. That's a wonderful solution, Rheumatoid arthritis or cancer, which one do you want?
Just many side effects. Right?
Let's just do something that corrects that, what we call the TH1, TH2 balance. And that's what, a number of the phytocannabinoids, not just cannabidiol, which is what, the buzzword of CBD, is just one of 80 phytocannabinoids in full spectrum hemp oil. And they all have, they're just not, the others haven't been studied as much. So they don't have the, the name recognition that CBD has.
Gotcha.
So
now,
it doesn't mean they're not as powerful. They're not just as powerful as CBD.
Gotcha. So let me talk to you a little bit about the opportunity. You're an MD. You've got a lot of patients. You're busy. I know you eat lunch and do 12 other things at the same time while you're doing it in your office. How is it that you see this fitting into your practice? I mean, I know you're prescribing, but you're also building a team of people that also want to benefit? And what do you see for the people that are joining your team?
Well, I think the thing I love about this company is that they've made it really easy and accessible for everyone. It's a double-edged sword being a medical professional, because I can say to someone, you need to take this, and they'll buy it. They'll try it. If they get results, they'll stay with it. But on the other side, it's like, how do you make that transition to help them to see the income potential? I've always been in any products that are network marketed, even though they're fabulous products, you hit that point of like, I can recommend the product, but how do I get people interested in the business opportunity? The wonderful thing about CTFO is that they have gotten rid of that barrier of, you have to spend a lot of money to get in, you have to promote, you have to promote the business, you have to switch over from the product to the business in order to make money. CTFO solved that by just making the ability to enter in, get your own website, get your products at wholesale, and then
for free, right? We're talking about a free
cost,
business,
no
free
commitment.
websites,
Yeah.
right?
No
The barrier
commitment.
entries are gone, pretty much.
Yeah, you don't have to be on an auto ship and make a commitment. You don't have to put your social security number in. All this,
all those things
and so it becomes very easy. So someone can be a customer, and then if they want to share it with their friends, it's true referral marketing, which is what network marketing
or affiliate marketing. It's set up to go viral. It's set up to just say, hey, listen, I'm taking this, it's doing this great thing for me, here's my link, get yourself an account. It's free to get an account and buy your stuff at wholesale,
right
wholesale, really.
So whether somebody becomes a customer or whether they start to become a referrer themselves, referring their family and friends and contacts, I mean, they can do either way, and they can make that transition smoothly instead of going, oh, I'm gonna start working a business.
Right.
Instead, they can just kind of do it organically, and the more results they get for themselves and their family, the more interested they're going to be in talking to other people, and people are going to be asking, well, what are you doing? How did you get off your blood pressure medication? How did you get off your diabetes medication? What did you do? Oh yeah, I took this really great 10xPure 500, and that's what worked for me.
And there are 70 products. So, you got hair growth products, which I don't need, thankfully. But we need hair growth products. We've got pet products. We've got products for pain of all kinds, creams and tinctures, even now vape oil. You have gummies. From what I understand, that 30% of the consumption of CBD oil is done in the form of vaping, which I know that there's a reason for that. Maybe you can touch on that. We offer that as well.
Right, and I've not been a huge fan of vaping because
me neither.
What's in your lung. However, it's well documented that when you vape, your lung has a lot of surface area, so you're actually getting good bioavailability. Even with just a straight oil, you're going to get good bioavailability because you're putting it into aerosolizing that into the area that has so much absorptive capacity because of the amount of surface area in the lung. So you get a very rapid and very effective way of getting it into the system.
So would you say that going with the tincture under the tongue would be the next best bioavailable way that's on the market? I
think the 10xPure is the best product.
Well, yeah, the actual product, yes, but right, or even better than vaping.
Bioavailability, I think they haven't done the studies yet. I think they're working on them.
They are working on them, yes.
Exact bioavailability, but I think that it gets adequate absorption and rapidly enough that you don't have to vape. However, people enjoy vaping, and it does get very rapid onset of action. I know they use it a lot for pain. People
right.
Pain a bit.
Right. You and I aren't in any pain. So if I was in pain, I would vape. I would do whatever it took to get that taken care of. Right.
Exactly. And I like the fact that CTFO has a very broad line because everybody's different. Their needs are different. The amounts that they need to take to get an effect are different. Some people are going to be sensitive to higher milligram amounts. More is not always better. And interestingly enough, in the case of hemp oil, a lot of times people start out either they have to start low and build it up, and then over time they need less because they've saturated the receptors, and they just don't need to take as much to get the same effect.
Is low dosing something that should be done?
For some people, yeah. I mean, I think you have to, it's somewhat individual in terms of the response. But if I very seldom see any side effects, but if somebody is feeling like it's feeling a little too much, start with just a few drops. It doesn't mean, and I've seen patients respond to just a few drops. They don't have to take a full dose. I had a friend that had mouth ulcers. She had a disease called lichen planus, and had tried 4 different hemp oils for 4 months each with no response. And this is a pretty serious autoimmune disease, and it's pretty painful. And it was pretty awful. I mean, there were times when she couldn't even talk or brush her teeth or anything because it's so painful. A hydrophilic hemp oil, within minutes, the pain's gone. Within 3 days, the ulcers healed and have never come back.
Wow.
Basically cured an autoimmune disease.
Wow.
So, and she has never taken a full dose, ever.
Okay.
And just a few drops. She's a sensitive person. Few drops, and it takes care of it, and it does what it needs to do. So more is not always better. Bigger dosing, getting the 1,500. You don't always need to spend that extra money to get the top quality. Now, if somebody had a really serious illness,
sure,
then I would say go for the big guns. But most people don't need that. They'll get plenty of benefit with a lower milligram amount.
And that is one of the great benefits too of the 10xPure is that CBD oil in general is pretty expensive. So if you can 10x or 8x or whatever the actual test comes out to be when they do the study, get that much more absorbability and bioavailability from our product, then you can buy a lesser strength and get a result as if you bought a stronger strength. So you can get like you say, the 500, which is
right.
about $100 a bottle, which is still a very affordable CBD oil, or the 1,500, which is $149 or $159, and get as if you were taking, a 3,000 or a 9,000 respectively, right? So that's an incredible benefit because I've looked out there and they're pretty expensive,
Yeah. Well, the first company that I tried their hemp oils, I want to say 4 years ago, it was $300 a month.
Wow.
And patients weren't responding. I mean, it's hard for me after the first couple of people. I was excited about it because of the science, and then I'm not seeing results. It's like to ask somebody to fork out $300 a month.
Right. Exactly. That's kind of tough. That's
kind of like, oh, whoa. I got off of that one real quick, and then I tried a couple other, the famous ones everybody knows, and Charlotte's Web and all this.
Sure.
A few people got some benefit, and some people will get benefit. They will notice a benefit, but when you have a product that's as bioavailable, then you start to see really rapid onset and really
that's awesome.
Very, very good results. Consistent.
Well, we're coming up on a little over a half hour here time-wise, so I think we should see if we can open it up for some Q&A and maybe discuss some other topics in the little bit of time we have left. I know we have Bridget on the line. Let's see if Bridget, maybe I'll unmute her and see if she's available. Oh, I'm having trouble unmuting. Let's see, unmute audio. She's still on mute. Okay, well, Bridget, I'm having. Oh, yeah. There you are. Hey, there you are, Bridget. Okay, great. I don't know if you had any question, Brigitte. We're available for Q&A.
I do. So, Robban, you said that hemp oil is a bioconcentrator, and so it pulls toxins out of the soil. So, how do we make? So I know that is organic, but I heard that even organic rice also concentrates arsenic, I think. So I'm wondering, how can we avoid that that the hemp oil cultivated in an organic way also concentrates bad stuff? Do we remove it at some point in the process, or what?
Well, I know that all of CTFO's hemp oils have been tested, and those lab reports are, the lab analyses are available, I believe, on their website on the back office.
They're right on the website. Matter of fact, in the front office too, you can find those.
You can find that even like before you sign up, or
yeah, and they're pesticide free. I mean, all those lab tests are done.
So you can look, and it's like all the heavy metals are there. They test for all the heavy metals. They test for all the pesticides. I forget how many, 60 different pesticides or something. For mycotoxins, which is really important, with any agricultural product. If it's kept in a silo, it can mold, and then you can have mycotoxins. It's mycotoxin free. And then they test for the solvents to prove and demonstrate that it's, extracted in a way that does not introduce any kind of chemical or solvent. So those studies are available on all of the products. So they are sourcing it from organic farms in Colorado. I don't know. I know that the West Coast, Washington, Oregon, California there's a big vein of arsenic that goes through the West Coast. So I think if it were grown in California, we might have more concern about that. I don't believe that that's in Colorado, and that's where all of our hemp comes from. So I think that it may depend on where it's sourced from. But when I refer to it as a bioconcentrator, of course, in, say, India, there's a tremendous problem with arsenic in the soil. And that's one of the things that they use it for, is to reclaim soil that's been contaminated. But then you have to make sure you're not consuming that, obviously.
Want to make rope out of that, huh?
Yeah, make something out of that one now.
Paper. Great question, Brigitte.
Okay, yeah, so that's good. And then you said that the 10xPure is made of two things, something that's antiviral and bacterial and cancer and all that stuff, and then hemp oil. I thought that 10xPure was just hemp oil, 10x hemp oil, but I'm not familiar with the other ingredients of this 10xPure product. Is there something else? It seems like there is something else.
Yes. Yeah. There's a product called 10xPure. It had another name when it was being marketed by itself, which I'm just not recalling right now. But it was developed actually off of a patent from Nikola Tesla, and where he ozonated oils to increase the hydrophilic nature and make them more bioavailable. And so Willem Laverius in the Philippines developed, he took 5 essential fatty acids, lauric acid, palmitic acid, oleic acid, linoleic acid, and did I say lauric acid? I'm sorry, that was like,
I believe so.
What the 5th one is, blocking on it right now. There's 5 oils that he combined, and then he oxygenates them, and by adding that oxygen, it takes the oils from being hydrophobic, hating water, to being hydrophilic, loving water. So it's able to pass through cell membranes more readily.
I see.
And there are other companies that are trying to take hemp oil and make it more bioavailable by making it liposomal or micellized or various,
nanotechnology.
Nanotechnology, exactly. And they're trying to make it, and they're having some success. I mean, if you take it from 6% to 30%, you're going to still get a better effect than if, with that product than if it was left at 6%. But the thing to me that's so cool is that the addition of the 10x oxygenated oils adds the benefit of those oils, those components, as well as making the carrier molecules for carrying them and the phytocannabinoids across the cell membranes, across the gut lining, across the blood-brain barrier, et cetera. So it's not just, they're not just doing something that's altering the hemp oil. They're actually adding something that adds another benefit as well as making it more bioavailable. Does that make sense?
Yeah, totally. Thank you. Because I was wondering, what is the other product?
Right, we call it 10xPure, but what it is 10xPure, that specific oils that Robban mentioned, mixed with our existing CBD, and we call it 10xPure because obviously that's a great marketing name, and it's working extremely well. And it kind of describes what it kind of does. It 10x's the results that people get or would expect to get from their CBD oil.
Yeah, good. And then one last question, if I may.
Mm-hmm. Go ahead.
So the vape oil. So I used to work in an office where somebody was vaping. It was about 2 years ago, and I thought, this doesn't feel right. And there is a very strong flavor, and those flavors are really, really just nice. It's hard to resist and to say, wow, this sounds bad.
Yeah.
And I heard on the radio that in those vaping products, it seems like there are a lot of heavy metals coming from this, the scent, the flavor, how do you call it? The scent, I guess. And so this vape oil also has those flavors. And so is there also a danger of getting heavy metals while vaping those flavorful hemp oil products?
I think that's a very good question, and I will have to look into that because I'm not exactly sure. I think if you use essential, like natural essential flavors, it would be fine. But because there are some additional benefits to the terpenes and the other components in essential oils. But just like when you get flavored coffee, it could be something that's a natural, like come from a natural source, or it could be a chemical based flavor, which obviously wouldn't be what you want. Like people flavor coffees, they flavor natural flavored seltzer water for goodness sakes. Is it really is the orange flavor really from oranges, or is it from something that reminds your body of the flavor orange? That's chemical.
Right.
Based. And I think it's the same question, and I'll have to look into that. CTFO is so careful about all of their products that I would be surprised if it wasn't from a completely natural source, but I will check into that because the vape product has only been out
a couple weeks
recently. And I've been so focused on really on the 10xPure, my two favorite products, the 10xPure and the Ultimate Deep Healing Pain Oil, which is phenomenal for any kind of pain, really.
My mother just purchased those two products. She's had back issues from an operation, a lot of pain she suffers with. And, she was taking something that was prescribed to her by her doctor. She's out in California. And, of course, there was THC in that product as well. And, she didn't want to be high. She just wanted to get rid of the pain. And so she was very excited to try the 10xPure and also the Deep Healing Cream. So she ordered that just the other day. I'll keep you posted on how it goes. But boy, she was very excited to get a hold of those.
Yeah, I've seen pretty consistent results with especially with that pain cream, is the Deep Healing Pain Cream. I've had people where their pain goes away in 5 minutes, and it's and pain that I wouldn't think that's like deep enough that I wouldn't think that a topical product would work. But it does. So the way they've combined it, I guess, with the hemp oil, with the emu oil, it's really getting deep into the tissues. And it really is working for people with back pain, knee pain, neuropathy, all kinds of stuff. That's
awesome.
Great.
Well, I want to thank you for taking some time out here as we kind of wrap this up. I'm just really excited to team up with you, Dr. Robban, and to be able to help so many people because the testimonies that I keep reading about CBD and CTFOs specifically, products that people are getting is just kind of outstanding. So I know you're doing an amazing job with your patients and a lot of the people that you're bringing on. And I just want to let your team know that I'm here to help. I've got a lot of years of experience doing this type of marketing. And it is an affiliate type program, and it really feels that way, that you're sharing something that could really change their life. And you just really want to reach out to everybody because it is my belief, understanding of where this industry is going, the size of it, is that everybody around you is either going to try hemp and CBD products, have already tried hemp, CBD products, have run out, and then don't want to try yours. Or, you know, it's on their radar and it's something that they've been thinking about. And so if we reach out to people that we know, you know, your address book contacts, your Facebook contacts, your LinkedIn contacts, send a private message, not a, you know, not a post on a wall, but a private message, and you reach out to people, you're going to get people responding back to you saying, yeah, I'd like to know about that. Or yeah, you know, so-and-so, they'll have some story, but they'll want to, you know what you're doing. So it's something that can go very, very fast and create a nice residual income. Because once people get results on a product, you know, if my mom gets results on that product, she's going to keep buying it over and over and over again.
Mm-hmm.
Seen that too, right, Robban?
Yeah.
So anyway, as we wrap up, any final words, Dr. Robban, to the team?
I'm just really excited about this product. I'm excited about the company because when I was, they actually flew me out to their event, their conference, the end of September, and I had the good fortune of meeting the owners of the company, the guys that started it all, and they are just awesome. The level of integrity and, you know, heart-centered, caring about really doing the right things for everyone, doing the right things with the products, doing the right things with the way that it's being marketed so that it's fair to everyone, compensation is fair to everyone, the cost and the you know, ability to get started with it is just fair to everyone. And I just, to me, it just feels like the right place to be because it's, you know, it's on so many levels, the integrity is there. And
yeah,
that's always important to me, you know, always important to me. So I'm excited about it. I think we can make a huge difference in a lot of people's lives. Yeah.
Well, I'm looking forward to doing that with you and with everybody on your team. You're right, Stuart and Michael are amazing owners and have always been doing the right thing for the field, for people who are out there building the business. They always, you know, are a distributor first, you know, kind of company, and that's what my experience with all the years that I've known them. So anyway, glad to be a part of this. I'm going to stop the recording. If you are looking at this and you're seeing this for the first time and you're really considering it, you know, get back to Dr. Robban, myself, or somebody on the team, and we'll help guide you through and show you how we're doing it. It's already making some pretty significant weekly checks for a bunch of people that we know and ourselves as well. And, you know, we're just getting started. So thanks for being on the Zoom webinar or catching it live or recorded, and we'll be back to do some more of these. So thanks so much, Robban, for joining us, and everybody else for watching.
You're welcome. Thanks, guys.
Bye.